Hey guys, got a something interesting for you today. I've got an interview with my ENT specialist, Doctor Crystal Smith from Mediclinic Middle East. She is the specialist who first diagnosed my throat cancer and found the symptoms, worked me through the process, and basically got it going. So I feel like her insights to throat cancer prevention, symptoms, and just overall throat health might be pretty interesting for you to hear. So here we go, the interview with Dr. Crystal Smith. So, Dr. Crystal, you welcome to today, and thank you for agreeing to talk to me. And you're the ENT specialist who detected I had cancer and basically started all the road to recovery and basically saved my life. I can't thank you enough for that. So, I want to start this off with saying a big, huge thank you and talk a little bit about you.
Lee, hi. You're looking good.
Thank you very much. So, you get to see me every 6 months. So that's when I hear you say you're looking good. It means I'm hoping that's an improvement every 6 months.
Definitely. Definitely. Yes.
So, why did you decide to become a doctor?
So, Lee, I have to say that was a decision I made in high school, although there were other options at around that time. But the more I thought about it, the more I read about it, I just felt that, um, first of all, it is a noble profession, and just the fact of being able to be out there to help and, to heal in the best way that we know. I thought that would be very gratifying professionally. And so, yes, so here I am 23 years later.
Well, and I'm certainly glad you did. I'm very grateful for it. So, and how long? And so did you start off as ENT, or is that what you started with and went all the way through as ENT, or were you a GP to start with, or I don't know how this works in the medical world.
Yeah. So for me, I went into post-graduation or into my specialization soon after my bachelor's degree. And yes, it was straight into ENT.
Okay, fantastic.
Yeah. And that's how it's been all along.
Okay, and so now I'm going to step a little bit forward from the ENT back into 2022, 2021, 2021, I guess.
One, yes. That's how fast time flies, Lee. Yes, 2020.
It seems like it was yesterday. So um, when I first saw you, and we were talking about the swollen lymph node and the pain had gone away from the ear and the sore throat, and you saw the swollen lymph node. Did you suspect that anything from that? Did it look weird to you at that time, or was it like it's kind of a normal cold thing?
So, Lee, when I saw you the first time, it was based on what you told me, so your history, and from what I examined in the clinic, I was very suspicious of that swelling.
Okay.
It's not the case with every patient. There are different kinds of swellings, different histories. It's the way the swelling feels, the way it looks, how many days it's been there. Yeah, but yours was definitely very suspicious, which is why we moved on to the next stage of testing.
Right, exactly. And I think the very next stage was another ultrasound. And you looked at that. Yeah, you looked at that and you said, "I think it's gotten bigger, so we're going to go a little bit farther." Um, and during that, we also did the that lovely laryngoscopy, that lovely camera. My favorite part of the whole thing of coming to see you, right?
You, you've always hated it, Lee.
I know there's not I can't say there's anything really pleasant about it, but I will say I do enjoy watching the camera while you're doing it because I think all that stuff's absolutely fascinating. Um, so when you use that laryngoscopy, what are you looking for when you're going in? So let's say with me we had the swollen lymph nodes. So are you look what?
Correct. So, I was looking for a potential pathology somewhere, a lesion of sorts, so to speak. Now, that's a good diagnostic tool. You've experienced it. It's a camera that goes in through the nose, so we have a look at the whole nasal passage, the back of the nose, the back of the throat, going all the way to the middle of the neck down to, the breathing passage. We can also see the opening of the swallowing passage. Now, so when we do that, we look for a source that's causing that enlarged lymph node. So, like I said, a lesion.
Right. Right. Okay. So so after we have these common symptoms, I'm looking at my questions here because I can't remember this stuff. So, how long after the appearance of like a typical symptom, like the sore throat, and I'm going to use my own, the sore throat, the earache, the swelling of the lymph nodes, is it advisable to start looking at going to an ENT or getting a referral to an ENT? When should I start looking at those things that they're now really kind of more suspicious than just a sore throat or a bad cold or
Yeah. So just following up on your last question. Now, whenever there's an infection or an inflammation anywhere in the head and neck, that could lead to these lymph nodes swelling up. Those are just indicators that there's something going on somewhere in the head and neck. And we've got lymph nodes all over our body. We've got hundreds and hundreds of them in our neck. So let's say somebody's got a flu or a tonsillitis. They can have lymph nodes swelling up right there, both sides of their neck, or the site of the infection. That usually takes about 2 weeks, give it up to a month for it to slowly settle down, to go back to its original size. Yeah. But if there's a lymph node that persists or is slowly increasing in size, if there's an associated pain or a referred pain to the ear or to, the back of the neck, then we would say, yes, now's the time to step in because it doesn't look like it's uh, shrinking, it's getting more painful, and now's the time to step in. It could be an infected lymph node, it could be an abscess forming in the neck. So it doesn't always have to be, you know, um, a situation where there's a cancer. I know most people will come in nowadays because of the easy access to the internet and they read the worst. So somebody who's got a lymph node there for about a week, 10 days will still come in because of what they've read on the internet.
right, exactly.
So there are several reasons why those lymph nodes swell up.
And that's the other thing is I wanted to make sure I pointed out at some point that just because your lymph nodes are swollen doesn't necessarily mean that you're on death's doorstep with cancer. It can very well be you've just got a really nasty cold going.
Correct.
Excellent. So, because I've had people ask me that I've got swollen lymph nodes, what should I do? And I'm like, talk to your doctor first, and let's go from there. It's not necessarily the end. So just take a deep breath, talk to your doctor, and follow their advice, which I think is pretty good. Pretty good advice is to always talk to your doctor. So, um, so what is the typical protocol when you suspect, as an ENT, when you suspect that the symptoms may be more signs of a throat infection or maybe a bit more than a throat infection, like maybe into cancer or something like that? What's kind of the protocol there for, I guess what I'm trying to say is the investigative protocol.
Right. Okay, so like I said, if we find that those swellings are not reducing in the time period that we expect it to reduce, or if they're progressively getting worse, then we would follow that up with investigations. So usually an ultrasound,
Okay.
okay? And if it shows features of suspicion, then yes, we would then follow that up with a fine needle aspiration. It's where they put a little needle into the swelling, take a sample, and then we look at it under the microscope and get a report. If that needs further investigation, then we move on to a CT or an MRI scan to get better definition of the swellings.
Right. Okay, that makes sense because that's exactly, it seems like that's the exact protocol I went down. Once the treatments are over with, you kind of fall off of the cancer team and fall back into the ENT GPs and stuff like this. So I wanted to ask, what do you recommend for like pain relief, symptom management, like after radiation, for like the pain in the neck, the dry mouth, the increased the mucositis, things like that? What are some things that you would recommend that somebody can do?
Yeah, those are all very uncomfortable side effects of radiation and chemo. Um, Pain management, of course, is several available different kinds of pain treatments. Um, if you know regular Brufen or Cataflam, any anti-inflammatories help to settle the pain down. Yes, that would be an option. And then, of course, it depends on the pain level, and you just go higher uh, in the management or in treatment, in the medication, depending on how much pain that patient can tolerate or not tolerate. Yeah. So Panadol, anti-inflammatories, and then the list just gets longer as to, or the options become more depending on the level
All
and
right.
the intensity of pain. For mucositis, it's really about keeping the the mouth lubricated, so sips of water through the day. There are special goggles that are more glycerine based that help to moisturize the throat. There are sprays, antiseptic sprays, some of them with lidocaine, which help to anesthetize the mucosa or the skin on the inside. All of these would be helpful.
Okay. Excellent. Good deal. So we can get a little bit better. We can do more to kind of help ourselves along towards during the recovery process. Then the
Oh,
pain
yeah.
and the mucositis and all that. So it sounds like there's some good stuff out there to help along.
Yeah, oh, for sure, for sure. There are a lot of things that you can use.
What are some of the things? And I get these questions a lot. Or what are some of the things we can do to reduce or lower the risk of getting throat cancer?
So let's look at the risk factors that cause throat cancers. Top of the list would be alcohol and tobacco, so smoking. Yeah, because these are local irritants to the skin on the inside, or what we call the mucosa in the oral cavity and in the throat. So these are major etiological factors. Of course, in parts of Asia, South Asia, uh, a lot of them have this habit of chewing betel nut. So that's another cause, and you see that amongst the lower section of society, where they will then, because you're not aware of it, so then they chew betel nut for long, long hours during the day, and that's also a local irritant, can give rise to oral cancer.
Okay.
Looking at viruses, the HPV virus, which is, it has been in the spotlight for a while. That's another cause of cancer. Then people who work in polluted areas. So when I say that, those in construction, because of asbestos and the fine dust, that could give rise to cancer. Those who work with chemicals, um, it's a job they do, but they're exposed to all these harsh elements, which could again cause irritation in the throat, at the back of the nose, and could give rise to malignancies as well. Yeah. Exposure to radiation, yeah. Exposure to radiation in itself is a cause for cancer.
Exactly. So, and one other thing, and like you said, HPV has certainly seems to be kind of in the spotlight here in the last several years, and I'm still kind of amazed at the number of people who are kind of resistant to their children having HPV vaccines and stuff like that. So I'm gonna ask, as a ENT, do you think that the HPV vaccine can, over the long term, help reduce the number of cases?
For sure, that's what research has shown that it has helped. It is helping really. It's a very effective vaccine. It's just that we haven't given it enough attention. We don't speak about it as much. There's no advertising as should be. Um, and then these vaccines are advertised for preteens, going up to the age of let's say people in their mid 20s. But I think we need to do a little bit more work on that.
I think so too. I was looking at that, and I was even surprised to find out after after I'd gone through my cancer thing, I was looking at HPV, and I was surprised to find that there was an HPV vaccine, and I had never heard about HPV that much and had never heard that about a vaccine. And it's amazing that even, I think it was 1989 in the UK, they were telling, young ladies to get the HPV vaccine, but it wasn't available for young men. They didn't need it, just the young ladies. And it was like, well, that makes no sense at all. So, but now it seems like that's now picked back up. So, but okay. Excellent. So yeah, I think you're right. I think that might be another video I do will be HPV and try to throw some spotlights on that. A little controversial, but I may still throw a little spotlight on there.
No, if it's going to help in the long run, then yes, it's definitely worth the discussion.
Well, listen, thank you very much. I won't take any more of your time up. Thank you so much for talking to me, and I will talk to you later.
Always nice seeing you and talking to you.
Okay, great. And I will probably see you soon. So, and that was it. That's the interview with Dr. Crystal Smith. I hope you found it interesting. And if you did, you found some things you could use and stuff, hit that like and subscribe button. We'll talk to you later. See ya.